Woman is recognized.
Thank you, Mr. Speaker. Good afternoon, everyone. I rise today to urge my colleagues to support my bill, the Maternal and Child Health Stillbirth Prevention Act. The United States continues to lead the world in medical innovation, development of new cures, and cutting-edge medical technology. However, the high maternal mortality and stillbirth rate in the United States is inexcusable. Over 21,000 babies are stillborn every year, and nearly 1 in 4 of these deaths are preventable. In the last 2 decades, the stillbirth rate in the United States declined by a negligible 0.4%. In a report published by the World Health Organization comparing progress in improving stillbirth rates, the United States ranked 183rd out of 195 countries. Our moms and our babies deserve better. The tragedy of a stillbirth, the unexpected death of a baby after 20 weeks of pregnancy, is devastating to mothers and fathers. Many women who endure a stillbirth have already picked out their baby's name or started decorating a nursery. The heartbreak of stillbirth leaves an unfillable void for the families that it impacts. Stillbirth disproportionately impacts minority, rural, and underserved communities, including many communities in my home state of Iowa that are designated as maternal health care deserts. I've heard from women in rural Iowa who drive over an hour to see their OBGYN or visit the nearest maternal ward or hospital and struggle to receive that quality care that they need throughout their pregnancy. Ensuring expecting women have access to high-quality maternal care regardless of their zip code or their income level is critical to preventing stillbirths and improving outcomes for both moms and babies. Congress must use every tool at our disposal to end stillbirth and support stillbirth prevention, awareness, and research. So that's why we're here today. My bipartisan Maternal and Child Health Stillbirth Prevention Act would finally dedicate funds towards stillbirth prevention and research, saving the lives of mothers and babies. Throughout my work on this legislation, I've had the opportunity to sit down with stillbirth prevention advocates who've turned their pain into passion. These brave women are on a mission to ensure that no mother, no father or family ever endures the tragedy of stillbirth again. And they are truly some of the strongest women I have ever met. I've been honored to fight alongside them to bring this vital legislation across the finish line, as well as with my co-lead on this bill, Congresswoman Adams. She has long fought to improve stillbirth prevention, and I am proud of the work that we've done together in a bipartisan manner to support expecting moms from Iowa to North Carolina and across the country. And additionally, this bipartisan legislation has been endorsed by dozens of women's health, public health, and medical provider associations, and it was passed by the Senate already in a similar form by unanimous consent. So I was blessed to be able to spend Mother's Day with my 2 sons over the weekend, but my heart continues to ache for the women who are mourning the loss of the child they never got to meet. So I urge my colleagues to join me in helping bring more wonderful babies and healthy pregnancies into this world by supporting this bill. Thank you, and I yield back.
Gentlelady yields. Reserve.